here we go. So this is part two. I'm hoping that some of you guys saw part one, which is predominantly just getting you ready to work with your veterinarian. Before I start, I think a big reason why I'm doing this is because I feel like, well, there's a whole bunch of reasons, but part of my practice was supporting people when they were out of province, out of country, with their veterinarians. So part of my like I said, my practice was dealing with people outside of my practice and patients outside of my practice to be their advocate, to be in their court. And I know that's really hard to do sometimes and really be able to get to that place. I also know with COVID right now that there are really long waiting lists to even go in and see your veterinarian, your regular veterinarian, for exams and issues that are going on, symptoms and stuff that are going on with your dogs and cats and horses. So hopefully this is also a little segue into if you have to, you have an ear infection going on with one of your animals and it's going to take 5 to 6 days or 4 to 5 days to get even 24 to 48 hours to be able to get on it right away and alleviate, number one, suffering. So that's my big thing all the time, is try and reduce pain, alleviate suffering, and then hopefully support you through that process until you can get in to see your vet. All right, so I can't stress enough that you need to try and get a holistic veterinarian or animal practitioner in your court, either through phone or email or in a clinic. But until then, this is sort of an introductory session to support you alongside of your conventional veterinarian. So working with homeopathy, we're going to talk about lots of different things, but my clinics, we were primary homeopathic practices. So we had the full bells and whistles with surgeries and rehab and chiropractics and scopes and conventional drugs. We had everything, but our primary modality of treating animals was with homeopathy. So as I said before, I'm not the guru. I'm just someone that really wants to support you guys and support your animals, because it's everything that I stand for and everything that I love so much. And this is my way of being able to try and do that. So in this session, we're going to be talking about using more than one homeopathic remedy at a time. That's also known as a combination remedy or combination remedies. The protocols that I'm going to give you right now, though, are protocols that I've developed with incredible success in my clinics for over 15 years. So it's not something that I'm just throwing together for this session. It's stuff that I've used within my practice for years. So when you're going to make a combination remedy, what you basically do is you take the remedies that I'll be recommending, and you mix them with a cup of water. You allow them to dissolve for about 20 minutes, and then you give it a stir, and then you can give your animal a ml, like 1 ml if you have a syringe or an eyedropper that has a 1 ml gauge on it, or you could give them like 2 teaspoons. Best way to do it is just open their mouth and squirt it inside their lips or up inside their gum line, and they can swallow some of it. They can, or if you sort of squirt it along, like my animals here at home, I just take it and I put it inside their lip, and then I move it around in their gum, and then that way it goes right into the bloodstream as soon as it hits a mucous membrane. If you can't give it that way and animals are really sketched out, or they're feeling really bad and they really don't want you to touch them, you can also mix it with a little bit of yogurt or raw milk, like a tablespoon, and mix the 1 ml or the 2 teaspoons in some yogurt or raw milk. So the first thing that I want to talk about, it's not a disease, but it can cause diseases, and we need to take it pretty seriously because it is You know, my good friend Andrea Ring, she wrote an article saying, using the word fixing dogs and cats, and sort of like, what, why did we come up with that term fixing when it does a lot of things other than fix something. Now, that's not saying that you shouldn't be spaying and neutering. I'm not saying that at all. I just often feel like we just assume it's so inert, like there's nothing, this, it doesn't come along with complications, and it does. But there are complications that we can try and derail or support. So it's a really personal choice, and it comes along with questions whether you should spay or neuter at all, what age to do it at, which procedures should I choose. Now, the should I spay or neuter at all, that's a big one for me, because even though I believe that animals are predominantly healthier when they have their sex hormones, I also believe that their quality of life is almost more important. So if you wind up getting a dog or a cat, and you don't spay and neuter them, it can limit their life, unless you are really lucky like me, that you live on a big farm and they can just run around and you don't have to worry about them fighting or breeding other animals, or creating havoc in a dog park or anything like that, or a cat getting, hit by a car out trying roaming for a female cat. So above all, for me, it's quality of life, because quality of life will, in my honest opinion, extends life. So uh whether you should spay or neuter at all, that's going to have to be your choice. But what we usually do is, at my clinic, is we would do something called an ovary sparing spay. That's something that you can ask for, where they remove the uterus, but they leave the ovaries in so that it can continue to produce some hormones. So that's one thing. Another thing is, please wait until after the animal's first heat. So let them go through. This may not apply quite to cats. With cats, I would try to catch them just before their heat, but with dogs, wait until after their first heat cycle. And with males, we would recommend waiting till after they're 1 year of age, so that their growth plates are closed. A lot of people don't understand that the hormones, sex hormones, are have a huge regulatory system of making sure that growth plates are closed, the bone density is what it should be, etc. Um, if you do, or when you do decide to spay or neuter, it's important to try and give some homeopathic remedies post surgery. And those remedies that we always use was aconite, arnica, phosphorus, and staphysagria. Aconite to deal with the really intense inflammatory response that the body goes into when it's had surgery. Arnica is an anti-inflammatory, major pain, and helps for healing. Phosphorus is to help to detox the body from the general anesthetic that they get, and also with any kind of blood loss. Staphysagria is a twofold remedy. It helps with the actual incision, to help the incision to heal properly and to reduce the risk of something called suture reactions, which animals can get. But it also has a really strong emotional component, and they use it with women that have been raped. They use it with people that have been in abusive relationships, or felt very suppressed. So it deals with that element of removing something from their body that is pretty vital and pretty important. So again, we talk about how to make the remedies and how often to give it. So you would give this combination every eight, as soon as you get them home, start giving it to them every 8 hours, and we do that for 3 times. The next thing you can do to support this is find a homeopathic remedy that's created for long-term support, meaning a constitutional remedy. So you would speak to a homeopath, and constitutional prescribing is not something that you would ever do yourself. And the reason that I say that is because it's very hard to treat things that are that close to you. It's really hard for me to give my own personal animals or my family a constitutional remedy, because I'm biased and I'm very close to them. So I can't really see outside the box as well as you have to be able to do as a homeopath. So It's a good idea to find a homeopath to try and a constitutional remedy is just to help the body try and stay in homeostasis when there's ups and downs and bumps in the road. So you can also purchase a homeopathic spay and neuter remedy that consists of reproductive organs to help the body mimic what the sex hormones would do. And Stephanie's going to put my colleague that I always talk about, Andrea Ring. She actually sells those remedies that you can use to support, and it's called a homeopathic spay and neuter protocol. You can purchase homeopathic spay and neuter remedies that consist, oh, I already said that. Pay close attention to getting a really good source of amino acids to support the thyroid, pituitary, thalamus, and adrenals. You want to be sure that nutritionally supporting those glands because they'll be trying to compensate for the loss of sex hormones. So hormones are a waterfall of vitally important signals that happen in the body to function with everything from your brain to your guts to your skin to your organs. And when one starts to decline or one is removed, like these ones, it will definitely take that waterfall and make it move in a different way other than just straight down. So you're interrupting the natural flow. So supporting the other glands that will have to like pick up the speed for the sex hormones, you really want to make sure that like I said, supporting the glands with amino acids and things that support the other pituitary, thalamus, adrenals, and thyroid. So cruciate ligaments and cruciate injuries. This is a big one. It's I remember when I first started to practice, like long time ago, in conventional medicine, I didn't see it very often. There would be overweight old dogs, big old dogs. Rotties had a tendency to come in that were 50 pounds overweight, and they would blow a cruciate. And but now everything gets it: skinny dogs, fit dogs, large dogs, small dogs. And in my personal opinion, the majority of these are not injuries. They're called injuries, but the majority of them are autoimmune related. And what winds up happening, I did I don't know now, maybe 14 years ago, I did a course. I went to Florida and did a canine rehab program. And there was orthopedic surgeons there. There was all kinds of different professionals. And by the end of the program, everybody was sort of on the same page that when you go in and you look at these ligaments, rarely do we see a true rupture from a perspective of some dog was running, 1,000,000 miles an hour and fell off a bank or whatever and truly tore their cruciate. Those are less often seen than ones that even though that's what they look like an acute injury. You don't even know that there's anything wrong with your dog's legs, and all of a sudden you're playing frisbee or they're in the beach and they come up completely dead lame and toe touching, or not even being able to put their leg down at all. But when we see a lot of those, when you open up the knee, the tendon is actually frayed. So you know that it's been on its way to doing that for quite some time, and then it just snaps. And in that situation, the majority of those are immune mediated, so autoimmune related. What we want to do is we really want to try and prevent these as much as you possibly can, and that would be with doing what you would normally do to prevent any autoimmune disease. So feeding a species appropriate diet, decreasing routine vaccines and flea medications, and using natural support whenever possible. So if your animal has an injury, you should start with these questions. And one is, don't automatically assume that it's a full rupture, you're going to want to find out whether it's a full rupture or a partial tear, because partial tears can actually heal quite well. And I would say that many are partial tears, but they look like full ruptures. So your vet will do something called a drawer to see if it has a drawer. So it'll have to see whether when you pull the drawer open, whether it moves open or not, or whether it stays. And even with pretty obvious drawers, they can still be partial tears. What's your animal's age? So are they even in an age or a health section that they could even have a surgery on their leg? And what is your animal's physical health and size? So is it a really big dog that's overweight and has Cushing disease, or has thyroid disease, or has a whole bunch of other, like a bunch of arthritis? It's really stand back and get all your questions answered and look at this from a high level perspective. Now, how we can support this when this happens is right away you can give them arnica 1M and aconite 1M, or 200C of each one if you can't get 1M. And you would do it every hour for 3 hours. Then when you take them to your vet, you can ask your vet if they're okay with giving you a 72-hour conservative approach that you can then use homeopathic remedies. This is where I would introduce a combination of remedies that Adored Beast actually uses, called Jump for Joints formula. And that's arnica, ruta, symphytum, and calendula. And typically in these acute cases, you would go very high potencies. It's an interesting little story. At my clinic, I produce Jump for Joints for torn cruciate ligaments and injured cruciate ligaments. That's how I came up with that formula. And then quite quickly we were seeing, how when I was saying that some animals have, they'll tear their cruciate, but they've already got arthritis or something. Quite quickly we were getting feedback with this combination, how much it was helping animals with their arthritis. So that's why we created Jump for Joints formula for arthritis or any kind of muscle skeletal injury at all. So once you give these remedies during this 72 hours, you would probably be giving them over the 72 hours. I would say you would be giving it to them every 4 hours over that whole entire 72 hours, or 4 times a day. You can start off, closer together when you're awake, and then you can give it just before bed, and then obviously wait that 8 hours until the morning, unless your dog's waking up whimpering because it's hurting or something. Then you're getting up to go to the bathroom, then you can keep the routine of giving them every 8 hours or 4 times a day throughout that time. If your animal weight bears, even if it's toe touching, continue giving these remedies until you recheck them until you get into recheck with your vet. So let's say your recheck, because everybody's so busy, your recheck's not for 5 days or 6 days. Then what you can do is, instead of giving it so close together, you can I would still give it to them 3 to 4 times a day until you wind up seeing your veterinarian. So if your animal's geriatric are compromised and you opt out of surgery, these are the things that you can do. Look for a company that specializes in and is well known for making braces for animals. In my experience, companies that use a mold, we used to use a company that you would get the mold shipped to you, and you literally put it on their leg, and it would create almost like a cast. And then that cast slips off, and then you send the whole cast to the company that actually makes the brace, because then it's really specific to your animal. Continue with homeopathic remedies from the prior slide. You can reduce them to twice a day. And then definitely do what we would do, because we had all of this thing. We were very lucky at my clinic. But things like laser therapy, swimming, physiotherapy, chiropractics, osteopathy, massage are all valuable in healing. My personal opinion is the brace Laser's really good for inflammation, but rehab swimming is phenomenal for these dogs because there's no weight once they can get there. There's no weight on them whatsoever, but you're building, they're not losing their muscle mass by not being able to exercise. Chances are that they'll do amazing without needing surgery. If your animal is young and toe touching and you would prefer to avoid or can't afford surgery, then you do the combination just like the geriatric animal above. So anyone that's going to choose for whatever reason not to go the surgery route, it's the same protocol for everybody. And I have to say, um, we did a lot of different things. We even did stem cell surgery for cruciate ligaments. But when I say that, people are like gasp because of the bad rap that stem cells get. But at our clinic, we would never do stem cells until we treated that animal for a year. So even if we were going to do stem cells, we wouldn't take the stem cells until we made sure that the stem cells that we were taking were really, really healthy so that the dog hadn't been vaccinated, wasn't on any drugs, was on a raw food diet, etc. But we had, not just doing stem cell, I'm not talking about that. We only did a couple of them. But I have to say we had at least 75% success rate in working with cruciates without doing surgeries. But I'm not anti-surgery on any means. But if you do surgery, I dig my heels in pretty hard here, where I really believe that orthopedic surgeons should really do it. I've seen I've seen vets with the best intentions and have done pretty good. I've seen some vets that have a knack. I used to work with a vet in Vancouver, and he wasn't an orthopedic surgeon, but he really had a knack, and he was great. But on the whole, you have to look at it that, how many are they doing compared to an orthopedic surgeon, a board certified orthopedic surgeon that's doing them all day long. They're working with bone and surgeries all day long. So I would really recommend that. Do a ton of research on all the different types of surgeries because there's lots. And when you go to your orthopedic surgeon, make sure you're asking them every single question you can possibly imagine with the different surgeries, as far as, how long is the dog laid up for? What are the side effects as far as even inflammation of the bone? What are the pros? What are the cons? And then make your decision. Don't let them bully you into a certain type of surgery. Make your own decision based on what feels right for you. Ask around. This is a big one too. Ask around to find someone whose animal has already had great success and make an appointment with that surgeon. Nothing is better than word of mouth. Someone saying, oh my gosh, yeah, you know what? My dog never looked back. He had this surgery and he just did amazing, flying colors right from the get-go, compared to, yeah, my dog had it too. And then, we had to keep taking him back in. And I'm not even sure if I should have had it because he sometimes limps just as bad. Da, 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 da. So even if you choose surgery, please continue to use homeopathic remedies and add some of the therapies, if not all of them, to the surgery on top, other than obviously the brace, to prevent the same injury from happening from the other leg. Now, this is a scary percentage, but they say that more than 50% of dogs will blow their other leg that's already had one cruciate ligament blown. And that screams to me the autoimmune, where that leg is already compromised. The inflammatory response is already there. It's shearing down on the ligament, and then all its weight is on that leg until the other leg that was injured heals. So I know more people than not that have had to have both done. Saying that, I would say 90%, 80 to 90% of the animals that we dealt with that had a cruciate surgery and we treated it with supportive care post-surgery, whether it was had surgery at a different clinic and was coming to us as a referral practice, so that the other leg didn't blow. I would say 80 to 90% didn't blow their other leg. So it's really, really paramount that if you do the surgery, continue to support the other leg. Dental care. So, again, can't say enough: prevention, prevention, prevention. It's like us. There's really no difference other than we don't have to be put under a general anesthetic. So it's almost even more important to try and keep your dogs and cats' teeth as clean as you possibly can. So you can brush them with coconut oil and use a mixture of coconut oil and probiotics together. You can use a toothbrush or a finger brush. You can get ice cubes and you can make them out of coconut water, coconut oil, and probiotics, and they can chew on the ice cubes. A big favorite, raw meaty bones. And then another one you can do is actually adding probiotic to their water bowl, so that when they're drinking, the probiotic actually covers their gums, washes through their gums and on their teeth. So if your vet is recommending an anesthetic, please make sure that 100% that is in fact necessary, because there's not, there are other options besides doing an anesthetic just to do a teeth cleaning. There's statistics out there that bones will using raw meaty bones, like big bones and femurs. They've done a study now to show that in 5 days, there's more than, I think it was 70% of the plaque was removed. So there are way, way better ways than just running out and doing a general anesthetic to clean their teeth. It's a bit different if there's a fracture in their tooth or something needs to be removed. That's a different, we're dealing with a different thing. But I know cats and dogs that go in for routine dental anesthetics and dental cleaning every year. And the stress of that anesthetic and that cleaning is really, really unnecessary if you're a pet parent that is willing to make sure that you're dealing with dental hygiene with your animal. But if they do have to have an anesthetic, make sure that you get a pre-surgical blood work done. I don't care how old your animal is, you should definitely get that done. If it comes back and there's an issue with kidneys or liver, then those organs 1,000,000% need to be supported for about 3 months and then retested before the procedure is done. The next thing, if there's a concern about periodontal disease or a really bad overgrowth of bacteria, while you're trying to support the liver or kidney. So let's say you have an older animal, they go in, they need a dental cleaning, they do a pre-surgical blood work, and yikes, their liver or their kidneys are not in very good shape. And you go, okay, so my gut's telling me that I want to support these organs prior to having a surgery done or an anesthetic done. What might happen is they might say to you, which is valid, that the bacteria from the periodontal disease or the bacteria from their dental disease is showering on their heart valve, is causing the kidneys or the liver to get worse because of the toxins, and it's valid. But it's still, if it's been like that long, chances are supporting the liver and kidney to just give them a better chance prior to is going to be much more helpful than just running in and doing that. And when you do it, what you're doing by using arnica, pepper sulf, and silica, you do it 30C twice a day for 2 weeks. If it's helping, then you can continue to do that once per week until the surgery date. And what that will do is that will help with the bacteria that is being filtered through those organs, waiting for the actual surgery to happen. So if there's extensive dental disease with many extractions, here I go again. I'm a big big supporter of board certified dentists or board certified anything, surgeons, board certified orthopedic surgeons. And it always cuts down on your animal's time under a general anesthetic. And why I'm saying that is for the same reason that I said about bone surgery. When all they're doing is dentistry, they can get in and get out really fast. And that's vital. That's vital when your animal is old and under a general. The longer it's under the general, more often it's under a general, the more complications, long-term complications are going to happen. So if you can get to a board certified dentist, they can go in and get out. That's ideal. After the extractions and after the surgery, uh, homeopathic support would be to give 200C phosphorus right away, and that helps again to filter, really helps to filter specifically anesthetic out of the liver and kidney, along with supporting blood loss, because there's a lot of bleeding when you do teeth, a lot. And then give arnica 1M, hypericum 1M twice a day for 2 to 5 days, depending on the amount of work done. If it's been a lot of work done, I would not be concerned about giving it for 5 days, even a week. So many veterinarians, including holistic vets, do not believe in hand scaling. But again, this is all coming from my personal experience in my clinic. I find it to be really effective if you follow the really stringent protocols that a good hygienist would use, which would be getting a qualified tech who's patient and uses a high pressure rinse with coconut and hypericum solution in it. The next thing is, again, give arnica and 1M and Heparsol 200C twice a day for 7 days following the procedure. And this is one thing that at my clinic, when it was being done, I was adamant about, and it really upset a lot of people sometimes, but I never let them do it in more than 4 sessions. So I would get them to do the top half, one side of the top half. They'd go home a week later. They would do the other side of the top. They'd go home and then they would do the bottom and then go home and do the other side. And the reason that I do that is for 2 reasons. One, so that they don't get so stressed that you can never do them again. So that they're in there for like 6 hours getting their hands scaled, and then they never want to come back to your clinic again, or they definitely don't want you to touch their mouth. And the reason that we're doing this is to try and keep them so that you can do it often, right? So that it doesn't get really bad, so that it's quick and easy. And another reason is if they do have sensitivity, they can still always chew on their opposing side of their mouth. So it's sort of a win-win. And I always say less is more, and taking your time and making sure that the animal's not stressed is really important in anything that we do. So anal glands. Anal gland abscesses, actually, not just anal glands. Anal glands are so easy. Anal gland abscesses or impactions are so easy to prevent with a raw food diet that's rich in bone. So bones that have been ground right into the diet. But if it happens, it's pretty simple to deal with. What you do is you apply hot compresses with green and chamomile tea, and then you can go and you can buy some hypericum tincture, and then you put a couple drops of hypericum tincture in the green tea and the chamomile tea, and you use it as warm compresses. Then you can give arnica 200C, Heparsol 200C, and do that 3 times a day for 4 days. Then you follow with silica 30C 3 times a day for 10 days. During this whole entire process, you want to feed soft bones, unless they're obviously completely allergic to poultry. And then you're going to have to find something maybe like oxtails or something that's easier to chew, but that produce a sort of calcium-like substance within their stools. This works the best for me for chronic anal gland issues. What I wanted to say quickly is that anal glands are made to be to express every time a dog or cat defecates. It was their tracking mechanism. It's how they, it's like reading the paper. It's how a group of dogs or a group of cats or a single dog or a single cat can smell another dog or cat's feces. They can know the sex, they can know whether it's sick, they can know how old it is. It's an important part of their body and their communication. And dogs and cats feces were never meant to just be this lovely little soft formed piece of poop. They were meant to be lumpy and bumpy and have fur from the animal that they just consumed, whether that was a rat or a deer or whatever it was. It was made to have bone mixed in it with it and different kinds of fibers, so that when it comes out of the anus, it has actually lumpy and pushes on the anal gland to express the anal gland. When we're feeding them food and they have a tendency to have softer stools or really, really uniformed stools, they will have a tendency to get anal gland issues. Or if they have allergies and the anus is inflamed, then that's what happens. So I'm going to go back to that really quickly. So couple prevention things that I don't have on here yet is I never recommend, nor do I like veterinarians or groomers to automatically express the dog's or cat's anal glands. And the reason that is that I feel like the more they're manipulated, the more they won't do it on their own. And if you think of a pimple or thinking of squeezing anything, what happens is when you squeeze it, there's a sphincter, right? Or like if you think of a pore, there's an opening, but in an anal gland, it actually has a little sphincter. And every time that's manipulated or squeezed too hard and it becomes inflamed, it scars. And when it scars, what can happen is then it won't express on its own. It's impossible. So I would be very careful with, like I said, vets and groomers, they do it to be nice and to give sort of a little perk with a visit, but definitely it's not a perk that you want to have. So you should make sure that that doesn't happen. All right, so kennel cough, it's going around a lot lately. Like I've heard it from a lot of different people that there's outbreaks of kennel cough in lots of different areas. And I was even talking to Stephanie and my marketing team today, and they have it a lot in Ontario, and we have it quite a bit out here. And so it's something that you want to pay attention to. It's highly contagious, and it's incredibly uncomfortable for our dogs. It has to be diagnosed by your vet. So the reason I say that is other things can mimic kennel cough, like, pneumonia or aspirated ammonia, or, if something happens and your dog has some kind of acid reflux or have some kinds of vomiting issues and they somehow aspirate a little bit. It can also, dogs can cough quite badly with heart disease. They can get laryngeal paralysis. There's lots of different things that can mimic it a little bit. So definitely make sure that you get it diagnosed. But first signs of any coughing. So if your dog all of a sudden just starts to cough, and until you can get them to the vets, I would do Arnica 200C or 1M and Aconite 200C or 1M to try to reduce its severity. That's not what you're going to do to help support it. You're going to try to derail it from getting worse, or the severity of it getting worse, before you go and see as the same day or until you can get in to see your vet. Once the diagnosis has been made, this is another combination. You can combine 2 pellets of phosphorus, 200, Drosera, 200, Spongia, 200, Ipecac, 200, and Arnica, 200. It sounds like a lot, but kennel cough is something you want to get on top of so that it doesn't linger and, your dog gets sicker and sicker. And the same thing, you put it in a cup of water, wait 20 minutes, blah, blah, blah. So if your dog is put on antibiotics, another thing is consider adding a high quality probiotics to their routine. And there's nothing, if you go to the vets and the vet says, yes, he's got kennel cough and you can't convince them not to put them on antibiotics, or let's say it's been a bit of time before you got them in and they can hear something in their chest, like a secondary infection in their chest, and they wind up going on antibiotics. Don't stop um, uh, that combination. You can still continue doing that combination with antibiotics. Remedies are not contraindicated when it comes to drugs. They're very safe, unlike some herbs and things like that. You have to be really careful of. Homeopathic remedies, you don't. And what this will do is it'll help to speed up their process of healing. The next thing that's important with kennel cough is supportive home care. It's really, really important. I always say to people, kind of with everything, put yourself in your dog's shoe or your cat's shoes or your horse's shoes, and imagine yourself in this case with bronchitis or some kind of wicked cough where you're coughing so hard that you can't get your breath and your throat feels like it's closing. Try to just, if you think like that, your home care is vital. Like, you can do all the homeopathic remedies in the world, you can do drugs or whatever, but when your animal's at home, it's really important to pay attention to how would you support them if it was you or your child or your aged mother or your partner. It doesn't really matter. So anything that they shouldn't be eating, anything that is dry. So no kibble, no dry treats, no bones, nothing sharp. Everything should be soft. A good thing, a little addition that's nice, is if you give them warm bone broth and you mix a really good quality Manuka honey in it, make sure it's melted. Don't just give your dog a spoonful of Manuka honey when they've got kennel cough. And the reason is because a lot of dogs, when they get kennel cough, they get mucus. Some of them it's really dry, but there's still mucus on the back of their throats. And if you mix mucus and sounds lovely, mucus and honey together, that's really hard to swallow, and sometimes they can start to choke. So you want to just make sure that all the honey that you're using is mixed and in a nice bone broth, and that really helps them. Put them on a raised raise their bowls, put them on a raised platter or raised whatever, a little table. And rather than giving them a bowl, you should give them a plate. And the reason, I always love giving animals plates anyways. I never ever, other than their water, I don't feed anything in a bowl. So again, just imagine if you can't breathe and when you bend down and you're putting your face in a bowl and there's not much air, it's just so much easier on them to go in a plate than a bowl and raised. You want to keep their immune system really boosted in this case. Sometimes you hear me talking about don't boost their immune system if it's autoimmune, but in this case, it's not autoimmune, it's a virus, and you want to make sure that their immune system is as strong as possible. You can use things like phytoplankton, homeopathic echinacea, probiotics, and medicinal mushrooms are very supportive as well. Keep their exercise to a minimum, and I mean a minimum. Outside to go pee and poo, and then back in the house. And whatever you do, don't restrain them with a collar, because the minute you put one of the ways vets will diagnose kennel cough is they'll squeeze their trachea and see if they start to cough, or if they've got a collapsing trachea, they can do that too. But they have very sensitive tracheas when they have kennel cough. And any kind of collar, any kind of restraint on their throat will get them coughing again. So what you're trying to do is reduce the amount of coughing that they get, because when they're coughing, they're constantly, they're getting it chronically inflamed, and it just takes longer and longer, and then they get more mucus, and the list goes on and on. The next thing is make sure that there's good airflow. So you know, make sure that they're warm, but don't get them too hot, because what you don't want to happen again is you don't want them panting. So if they're sitting there and they're going like that, they're breathing in air, they're breathing in air rapidly, and that's going to start them to cough. And for anybody that's ever heard a dog with kennel cough, it is horrific, and they cough and cough and cough. They have spasmodic coughs where it goes on and on and on, and sometimes they'll retch after. And that's why we use the remedies that we do, because they're specifically for spasmodic coughs and that end with retching and things like that. Okay, ear infections. I'm just looking at my time. Ear infections and yeast. First of all, please don't put anything in your cat's or dog's ear until your veterinarian has made sure that their eardrum is intact and they don't have a ruptured eardrum. When you're at the vets, make sure that they do a culture and a sensitivity. This is really important. This way they can find out whether it's yeast, bacteria, or both. And if for some reason you need to give them antibiotics, you will know what antibiotic that the infection is sensitive to. So you're going to hear me say about doing cultures and sensitivities and things like that lots, because I really feel it's important to, if you're going to do antibiotics, you want to take a perspective that you are going to kill that bacteria within that course of antibiotics, not partially kill them or, you know, use the wrong antibiotics. So then you do a whole course of antibiotics, doesn't go away. Then you have to do another course of antibiotics or a different course of antibiotics. Just freaking figure it out right from the very beginning and just do it right from the get-go. So my choices for remedies for ear infections, whether it's yeast or bacteria, it doesn't really matter. Again, always start with arnica and aconite. And again, you can do this before you even get to the vet. You don't have to worry whether it's yeast, whether it's bacteria, is it eardrum intact or blown. You don't have to worry about any of that. You just start giving it to them right away to decrease inflammation and help with pain. And you can do it every hour, 3 times. That's my go-to all the time. And then every 6 hours, 2 times after that. If it really hurts and it's really painful right from the get-go, all of a sudden your dog or your cat shaking its ear, and you scratching its ear, and you open up their ear and you're like, and it's stinky and red and inflamed and swollen and painful, you can start right away with belladonna. So you can add belladonna to your aconite and to your arnica, and you just follow the same schedule. If it's not that red or not swollen or not that painful, but it's more just itchy and they're shaking their head, then you could just use the aconite and arnica until you get in to see the vet. But once you do, you can follow either the arnica or the belladonna with silica and hepasulf. So whether you've done arnica and aconite alone or arnica, aconite, and belladonna, once you finish that, you can start silica, and hepasulf, and then you do that 3 times a day for 5 days. The next thing that I'm a big fan of is something called, I used it at my practice all the time, is something called Zymox Otic Enzymatic Solution. Dr. Judy Morgan, she has it on her website. It's amazing. I wouldn't suggest the one with hydrocortisone, nor even the cleaner, just the simple enzyme solution, and just follow the directions. It's the best ear stuff I've ever used, ear medication I've ever seen ever. I highly recommend it. So bladder infections, make sure, number one, that it truly is an infection and not something called interstitial cystitis. Interstitial cystitis is when the bladder wall is inflamed, and this is usually an autoimmune disease and not an infection. And I can't tell you, especially with cats get this a lot. Dogs can get it as well, but the amount of bladder infections that are treated with antibiotics that really aren't antibiotics, I can't even tell you how often that happens. A lot. Please make sure that it's not spay incontinence, that, again, you don't want to be giving spay incontinence, which is an issue when your dog has a reduction in its estrogen and or sex hormones, and it starts to just lose its bladder control. With cats, be sure that they do not have a urinary blockage. This is a life-threatening situation. So that's a really, really big one that we're going to talk about a little bit in a minute. But please make sure that your cat doesn't have a blockage when you're thinking that it's just an infection. So I would take in a sample. The best way to do this is with a sterilized stainless steel soup ladle. Try saying that fast. Try to catch the urine midstream, and don't touch your animal's body. So the first morning urine sample is absolutely the best one if you can catch it. And what you do is you just sort of follow them. And as soon as they squat, I mean, it doesn't matter if the bottom of the ladle touches the ground. As soon as they squat, try to slowly slide it in underneath, because don't forget, don't have to rush in and get the first little bits of urine that comes out. Slowly slide it underneath, and then try and let some of it come out and hit the ground. And then so you're getting sort of mid catch. For cats, you can always have something on. Oh, once you catch it in the ladle, make sure that you have a sterilized from your dishwasher container that you can pour it in. Put it in the fridge right away until you can, and try to drop it off at your vet clinic ASAP, or if you're taking your dog in or your cat in for an exam for a bladder infection, then bring it with you. If you're collecting cat urine, it's a little bit more difficult sometimes. It's always a good idea, if you have kitties, to have something called Nosorb on hand. You can just buy it from your vets. Nosorb is a sterile cat litter, and it doesn't absorb anything. So it's not even cat litter. It's just this black stuff that almost looks like charcoal, but it isn't. And the cats can move it and it feels like litter, but when they pee, it doesn't absorb any of it. So you wash their litter out, the litter box, you completely disinfect their litter and then rinse it. So make sure that it's completely clean. You put the Nosorb in, you leave your cat alone, let them pee, and then you take the whole litter box and litter and everything, and you pour it back into the container that it came in. Then you put that back in the fridge, and again, drop it off at your vet's right away, or bring it in when you're taking your cat in for their exam. Big time, be sure to ask for a culture and sensitivity with this, because this is going to show you again that it's true bacteria and not just bacteria from contamination. Your vet will be able to prescribe the correct antibiotics if one is even needed, instead of it being, a contaminant and they think it's a bacteria, but it's really just E. coli from it being dirty. And you can make sure that the right antibiotic is prescribed, which is really important, because in my time of having my vet clinic, the amount of bladder infections that I saw, animals that came into me and for second and third opinions because they had antibiotic resistant urinary tract infections. So even the antibiotics that were out there didn't work on the kind of bacteria that these dogs were getting in their urine. A lot of them were something called Proteus and some terrible stuff. So that won't happen if the correct antibiotics are chosen right from the very beginning. So homeopathic remedies for bladder infections. If there's a sense of urgency and frequency, so they're asking to go out a lot, or they're even peeing in the house because they can't make it out, or you just let them out and they pee once and then they get up and they walk again and they pee again, that's a very clear sign of a bladder infection. Always get it checked out, especially if you have an older dog, to be sure that it's not a prostate tumor. Make sure that it's not a tumor in their urethra or anything like that. You just want to make sure. And what you want, but you can start with this before you even get to the clinic. Like I said, sometimes if your animal starts off like this and you can't get an appointment till the next day, you don't want to leave them in this kind of pain. So start off with a combination of arnica, aconite, nux vomica, and cantharis, and you give it every half hour 2 times, then every 2 hours 2 times, and then every 8 hours for 4 times. You should see a difference in 4 hours. If your animal's getting worse or they're not getting better, then I would probably stop it. If you don't have anything else to go to, keep giving it unless they're getting worse. If they're getting worse, then you need to stop. For young animals or ones that are clingy and seeking attention, that aren't showing the urgency and the frequency, they're just going out a little more often, or maybe they've made some mistakes in the house, they've peed in the house or something like that, but they're young and you can actually see a string of mucus coming from their vulva when they pee or their penis when they pee, then what you can do is you use the same remedies, but you replace cantharis with pulsatilla. And then you just do it exactly the same way. You just don't put cantharis in it. You put pulsatilla in it. You can get puppy vaginitis that looks a lot like a bladder infection too. If you think it's puppy vaginitis or it's showing like that, you can do the same thing with the pulsatilla. So cats. If those homeopathic remedies that I just mentioned haven't helped from the schedule from the other slide, within 2 to 4 hours, you have to take your cat to the vet. It's crucial to rule out a life-threatening blockage. That's a really, really important. Now, when you get to the clinic and they do the exam and they say, yes, your cat is blocked, some veterinarians will recommend using a catheter. And at this point, I would urge you to ask them if it's possible, if they could try pain medicine and a muscle relaxant first, and allow them to give you their personal opinion on your unique situation. So they may say, absolutely no way. This cat's bladder is so massive. If we don't get urine out now, it's going to rupture. And then, you know what? You've got to do it 100%. But if they say, yes, your cat's blocked, but the bladder is small, so sure, let's try the pain meds and the muscle relaxants and see if he can pee on his own. Most of the time, blockages happen with male cats, and they come from crystals. So a lot of people don't know that female cats have crystals just as much as male cats, but they don't have the little tiny skinny urethra like the male cats do. So when a cat has crystals, what winds up happening in male cats is as they're peeing and urinating, it irritates the lining of the urethra. And then the urethra gets inflamed, so it becomes even skinnier. But then what it does is it spasms. So here comes the crystals down the urethra. And then this is the urethra. And then all of a sudden the urethra spasms and nothing can go anywhere. So the crystals get stuck and everything just shuts. If that's the case, by using a catheter, unless I said it's life-threatening, you're trying to push, they anesthetize them, then they're trying to push the catheter in and either push through the crystals. And what happens a lot of times is it scars them. It's because it's so teeny, eensy weensy that they wind up scarring the urethra, and then your kitty is more prone to getting blockages than before. So that's why I'm saying if you can ask them if you can do the drugs and wait and see, that would be the best possible solution. When an animal does have crystals, a dog or a cat, but like I said, lots of times, lots of cats have them, it can be managed extremely well with raw species appropriate diets and things like slippery elm, marshmallow root, homeopathic remedies called berberis and hydrangea to break down the crystals, and NAG, which is N-acetylglucosamine. Stephanie put this in, it was so cute. It can be easy peasy. Easy peasy is a protocol that I designed from my practice to give to cats and dogs that have crystals, but also just in general to keep their bladder really, really healthy. NAG is something that is, I can't even say it. It's like it's the most phenomenal nutraceutical on the planet for any kind of chronic inflammatory response around smooth muscle, like interstitial lining, the gut wall, the lung wall. So for cats that have interstitial cystitis, which I bet you tons of them do, NAG is phenomenal. So again, if you're concerned and you're not sure how to give all this stuff, and it would be way too long for me to tell you how many milligrams, where to get it, how to source it, how to make sure that it's a clean product and a clean ingredient. I feel kind of weird because this is not about selling our products. This is really about me helping you guys. But one of the reasons that I started Adore Beast to begin with was to do exactly that, is to create protocols to support pet parents to not always have to put their animals on drugs. Okay, pancreatitis. So I'm hearing and seeing so much of this that it almost feels to me like an epidemic. And it's unfortunate because raw food gets a bad rap with this a lot. And the more likely causes of pancreatitis are things like grain-based diets, toxic chemicals, drugs, rancid foods or cooked fats, stress and boredom, lack of sex hormones, or we go into the supportive remedies for spay and neuter, leaky gut, and unhealthy gut microbiota and enzymes. So for years, antibiotics were prescribed for pancreatitis, years and years and years and years and years, and they still do sometimes. But finally, veterinarians are following the human medical recommendations for this disease, and that is to give intravenous fluids and pain medication. And more often, and then supportive for me, some supportive holistic integrative products. So it really is the way to go, and not just throwing them on antibiotics, because then what happens if it is coming from something like the metabolites aren't being produced in the gut properly that produces the proper digestive enzymes that support the pancreas? Giving more antibiotics that are going to kill more of the friendly gut bacteria that actually produces those metabolites are going to be even less of a player to prevent pancreatitis than they were to begin with. So in our clinic, what we did was we would give intravenous fluids, arnica 1M or aconite 200C, and we would do them every half an hour, 3 times. Then we would be giving phosphorus 200C, iris 200C, and we would do them every 8 hours for up to 5 days. After 24 hours of being on IV and remedies, we would recommend that the pet parents give non-fat bone broth without onions. And if all is well, in 48 hours, they can introduce steamed or gently cooked whole foods, organic if possible, a balanced diet with enzymes. And then for animals that were on raw prior to that, I highly recommend cooking or steaming their food for a good 3 days, then slow, gradual introduction back to raw. And you can put like a tablespoon of raw in and do it really that gradually, so that if they go, oh, sorry, I'm still not ready for this, you've only introduced a very small amount, and you can quickly regain your momentum of the healing and just put them, just take that raw out. Don't be bullied into antibiotics. Be sure to talk to your holistic practitioner for support in this, because based on the blood work and based on everything, it's often not needed. Your vet will, for sure, in order to diagnose this will recommend a blood test. And please make sure that you've asked them to do something called the CPL, which means a canine pancreatic lipase test. I've seen really many animals present with sore backs before any other symptoms appear. So be aware, because this can be an early sign. And this is where the CPL test is really helpful, because I used to do it routinely. If I got something in, even cats, then it's an FPL. Even cats, if I had an animal in that was just overall feeling punky or over grooming, or maybe seemed a little hunched in their back, or they were just a little depressed or whatever, I would routinely do that test, because I can't tell you how many times animals have been diagnosed with something else when they'd had low level chronic pancreatic issues, and they just haven't got it bad enough to be in an acute, typical symptomatic state of showing pancreatitis. And it really can show up early, and with all different ways. Like we even had a pug no, it was a French bulldog, and it came in screaming, and they were sure that it hurt it. We were sure that it did something to a disc, and we did an x-ray, and the discs were fine. And I automatically was like, okay, this is interesting, because she had soft stool the day before. Anyways, we did an ultrasound and a CPL and some blood work, and sure enough, she had pancreatitis, acute, really, really acute pancreatitis. So just always make sure that everybody's checking off the boxes to be sure that it's not smoldering and underneath other symptoms. Oh my gosh. Okay. Skin disease. I don't even know where to start with this. It's kind of one of the reasons that I even started Adored Beast Apothecary to begin with, because years and years and years ago, I went to a conference, and one of the lecturers was a veterinarian from the SPCA in the United States. And she said that in her experience, skin disease was the #1 leading cause of euthanasia, elected euthanasia. And I was floored. I was literally like, couldn't believe it. And I still think that's the case today. I'm not talking about cancer, getting something and dying. I'm talking about a disease where people spend all their financial resources, are trying desperately to get their dogs to have some kind of quality of life, can't watch their animals suffer anymore, and they either give them up for adoption because they can't deal with it anymore, or they wind up euthanizing them because like I said, they've run out of resources on every level. It was a huge issue in my practice, and one of the interesting things with this is I never, ever, even from the get-go, I never believed it was a primary disease. And I always felt like it was a disease state that was caused by other things like drugs and poor diet and environment and things like that. Again, it's why I started specifically my leaky gut protocol within my practice, and why I wanted to try to get it out to as many people as I possibly could, because I had to find a way to not just, decrease the amount of deaths or euthanasia, but just long-term needless suffering that doesn't have to happen. So with this disease, we'll go through some different causations and stages, starting with post-vaccine induced. So the start of skin issues are often diagnosed in the beginning as puppy. They aren't diagnosed as skin disease. So they're diagnosed as puppy vaginitis or puppy penile discharge, ear infections, or soft stool. So I can't tell you how many times a puppy will go get its first set of vaccinations and boosters and whatever, and then they go back to the vets, and with what I just said, they've got vaginitis, they're acting like they've got a bladder infection, they're licking their vulva constantly, they're whining, or they've got like a really acute ear infection or soft stool, and this could happen, you know, a couple weeks after their vaccination. Um, Most of the time, vaccines don't even come into the equation. They just see them and they say, okay, you know, they've got this, and this, or they've just got an ear infection, and then they're starting off on antibiotics and they're 12 weeks old or 16 weeks old. It's the beginning stages of suppressed skin disease that is a symptom of the body trying to detoxify the vaccine. So I'm not talking about antibodies. I'm not talking about whether it's right or it's wrong. I'm talking about literally the body trying to get rid of mercury and thimerosal and the additives and the antigens and all that stuff that are in vaccinations. So vaccine-induced skin disease can also show up in adults. So it's not just for puppies. It can happen with adults, and it can occur 48 hours up to 2 months post vaccine easily. The animals are then given antibiotics, and here we go down the road of annihilating any kind of friendly bacteria in the gut, an overgrowth of bad bacteria and yeast in the gut, which then leads to inflammation, lack of nutrition, and chronic disease. So not getting to the root cause of so-called symptoms, pathologies, or a diagnosis of an ear infection, not getting to that right from the get-go and suppressing it with the drug can lead to lifelong issues, one being a very common one, which is skin disease. So ways to avoid this if you are at the beginning stages of this is giving homeopathic Thuya and silica right away, 3 times a day for 2 days. We have something that used to be called an anti-vax, it's called now Rebalancer. And I put the 2 top anti-vaccinosis, and again, it's not anti-vax. In no way, shape, or form is this anti-vax. It's a supportive homeopathic protocol to help the body rebalance from being triggered to fight a disease that is simply not there. So when you're vaccinated, the positive things about vaccinations is it makes your body think that it has this disease and put into motion the tools to create an antibody that will then protect that body the next time it comes in contact with that virus. But because you're not actually getting sick, because you're not actually getting the disease, and therefore your body's not truly reacting the real way a body reacts when you are threatened with a disease, its homeostasis, or its balance, becomes out of balance. And that's when other things can happen in like I said, the detoxification of the chemicals within the vaccine. So these 2 remedies are well researched homeopathic remedies to help the body regain that balance. So if these symptoms are in puppies and kittens and they're not resolved after Thuya and silica, you can then try pulsatilla and do it the same way. Just try it 3 times a day for 2 days. You want to load them up with antioxidants to try and help that sort of chronic inflammatory response, and just really good species specific food. Diet induced. So this is another way. This is for the animal with skin issues, has always been on a kibble diet, possibly, or a diet that has just been void of real food or real enzymes or real it's just void of the amino acids and the particulars of nutrition that support the skin and support the organs. The skin is the largest organ of your animal's body and our body. So it's not, we just look at the skin as some superficial covering. It's not. It is the biggest organ of your entire body. It filters and it detoxifies, and it grows and it repairs and it replenishes. It acts like an organ because it is an organ. So if we're not feeding proper nutrition that support that specific organ, then we're going to start to see disease in that organ. So again, if that's something that you believe that this is a contributing factor to your animal, you want to try and change to a diet that's raw and a balanced novel protein to start. So novel protein means a protein that you know that your dog or your cat has never had. So as long as you've had them, unless it's a rescue and you don't know what they've had, which is very common, try to get something like emu or kangaroo or something that they wouldn't have had, yak, goat, a protein that they wouldn't, that you know that you've never fed them or that has never been in their kibble before, that just gives the body a chance to breathe and relax without having that overreactive overreaction to the protein that they're eating. And obviously give a really good pre and probiotic to reestablish that bacteria, introduce digestive enzymes to help them to digest that food so that they're receiving their optimum nutrition so that they can heal faster. And again, add an antioxidant rich whole food supplement like phytoplankton. It's got massive amounts of superoxide dismutase. So anything you can find with high antioxidant values that's a natural whole food is great to mix, to put in this mix. So antibiotic induced, this would be an animal who was given antibiotics for other issues, even like vomiting, GI issues, trauma, injury, bladder infections, ear infections, which are most of the time the beginning of skin disease anyways, then develop into skin symptoms after the antibiotics. So this is something, you know, your dog had a GI issue or your cat had a GI issue. You took it into your veterinarians, they gave you the appropriate antibiotics in their toolbox. And then 3 months later, they start itching, or 6 months later, even they start itching, or 3 weeks later, they start itching. Chances are that those antibiotics destroyed the natural bacteria and friendly bacteria that is in the gut that produces, like I said, again, the appropriate metabolites, appropriate digestive enzymes, and stops pathogenic bacteria and yeast from forming, keeps them at bay, keeps them in their particular little groups, and doesn't allow them to be overindulgent in and take over your dog or cat's gut. And then really read up on leaky gut. If you feel like your skin disease, that you could target your skin disease on your animal happening after antibiotics, or you know for sure that your dog has or cat has had antibiotics and now has skin disease, do lots and lots of reading on leaky gut. And I would highly suggest that you start down that journey for sure. So another one is an animal born with an unhealthy gut microbiome. This happens a lot, and it's funny. I really believe that this is the one that, you know, when I first opened my practice, I saw a lot of end stage stuff, right? I saw lots and lots of animals that had been down the gamut, and they sat in front of me and said, if you can't help my dog, my cat, my horse, whatever, my guinea pig, we are going to have to euthanize them. And I saw a lot of stuff where there was layers and layers and layers and layers of drug-induced diseases and drug-induced pathology. And then the longer I was in practice and the more people came to me with brand new puppies, or they've already understood, you know, it's 10 years, 15 years into practice, and they're coming in and they say, you know, oh, well, this puppy or this kitten, we started them on raw food diets and we haven't over vaccinated them, and they've still got skin disease. So, you know, and everybody's stumped and scratching their head, and it's like, why would this be happening? So chances are that that animal was born with an unhealthy gut microbiome, which means that their mother probably didn't have the healthiest gut, therefore passed that on to that puppy or kitten. So again, it's sort of trying to track it, but I started seeing this a lot, and I started seeing this a lot when people, even if they were fed commercial diets and went the conventional route, but then we'd been trying and working on diets with them and, you know, not over vaccinating them or over medicating them in any way. That sparked my journey into researching and producing formulas with species specific probiotics, AKA probiotics that are made from the gut bacteria of healthy animals, dog, cat, horse, doesn't really matter. Because what that does is it re-inoculates the appropriate bacteria that would have been found in a healthy species. So the bacteria that came from a healthy dog, a bacteria that came from a healthy cat, a healthy horse, and using that specific species of bacteria rather than all the other probiotics on the market, which are predominantly cattle cattle species, cow made from cow, re-inoculating the gut with the bacteria that you would see in a healthy cat's gut or a healthy dog's gut, or like I said, or a horse. So that is the way to go for me if we believe wholeheartedly that our animals are missing that specific species in their gut to to re-inoculate that original species oriented probiotic. So a spay and neuter skin disease, this can be a huge causation of skin issues. Again, when we're doing this, we want, if we think that we've gone through everything and everything seems to be working just great, but we're still getting reoccurring skin disease, or it's still, what Hahnemann, the founder of homeopathy, would say is that this could be called an obstacle to cure, because you're not going to be able to give them back their hormones. And so what we want to do is we want to support them with amino acids. The hormone function is very related to you can do lots of things like glandulars, and you can do lots of things like, giving glands and organs from like organic grass-fed cows. There's lots of different ways to support their hormone function, including the one that I said at the beginning, which is actually a spay and neuter protocol. So drug-induced skin disease, I think I saw this the most of everything. These are the animals who have been triggered by any of the diseases that we've already covered, whether it's, pancreatitis or anything like that. So if your animal has had rounds of antibiotics, anti-yeast medication, steroids, antihistamines, countless different foods, including raw and supplements, and the list goes on, what we want to do then is we really want to look into supporting leaky gut. That would be my number one thing to tell you to do, because when you have years and years of trauma, gut trauma, you're never going to be able to find a healthy foundation until you heal the trauma of their gut. And that would be my first go-to. I would give amino acids, and then I would definitely use homeopathy to detox all the drugs that have been given, like nux vomica and phosphorus. My protocol at my clinic was to do 30C of both of those 3 times a day for 2 days. And that helps the body get rid of the toxins that are lurking around still from all of those drugs. Make sure you're providing liver support to help to detoxify the liver, but really be careful. I don't really like even the word detox, because often that comes along with healing crisis. And in my clinic, there was no such thing as healing crisis. I didn't subscribe to that. And I avoided healing crisis at all cost, because my main thing was to keep the animals out of suffering. you can detox and you can get to where you need to go without having to get there fast. And slowly working at a really, really deep level with the liver is much better than just giving them a massively strong detox. Overgrowth of yeast. Ooh. So it's a big one. It's a really, really big one. They're nasty pieces of work. They're disgusting, ugly things that chew away on their gut lining, cause them to be more itchy than you could possibly imagine. Yeast has like over 15 different massive toxins that they produce that cause your irritated, extremely sensitive, and very, very, very itchy. One of them being acetone. I don't know if you guys know what acetone is. Acetone is what you use to take nail polish, in nail polish remover. One of the toxins that yeast produce is acetone. So you can just imagine how your animal's skin feels when one of the toxins that these yeast produce is that. So first of all, make sure it's yeast. Then go slow. Slow wins the race with yeast. What I've seen time and time again at my clinic is people are, they want to get rid of it. They want to heal it. They want it gone like yesterday. And if you try and do it too quickly with yeast, you will get too rapid of a die-off, which is called a Herx reaction. And Herx reactions are when the yeast die too quickly, and then the actual yeast skeletons, they produce more toxins, up to 10 times the toxins as live yeast does. But they symptomatically look like the yeast is getting worse. So then what happens is your dog gets itchier, they get lethargic, they feel like crap. They can even get stiff because they're just so toxic because the yeast is dying too quickly. You take them back to the vets, they look at them, they're like, your dog just has disgusting yeast again. Then they wind up going back on antibiotics, back on anti-yeast medication, ketoconazole, yeast baths, the list goes on. And it's really not the abundance of yeast that they're seeing, is that they're actually seeing the yeast die off. So to do this, it's a very strategic thing, and it took me a very long time to understand how to kill yeast. And first of all, you've got to remove their starches and their carbohydrates first, because what you want to do is you want to weaken them. So your strategy to kill the yeast is to make them weak first. So the more you're not feeding your animal starches and carbohydrates, that's what the yeast thrives on. You're going to remove that from their diet, so the yeast starts to become weakened. Then you're not going to use probiotics. And yes, I did just say that. I'm like the probiotic queen, or the microbiome queen. It's bacteria. In this case, we don't want to use probiotics, and it's sort of for the same reason. We want to attack yeast in a different way. We want to try really hard to find particular digestive enzymes that when the yeast becomes weakened and starving, these digestive enzymes actually start to ingest and destroy the yeast. So I'm going to go to the bottom of this slide now, actually. So when we're doing that, we're looking at things like those specific digestive enzymes, caprylic acid, podarco, homeopathic remedies like sulfur. Again, I'm really feeling weird telling you about what I use. The reason that I'm saying this now is because it took me a long time to formulate Yeasty Beast, and to formulate it in a way that I knew was giving you synergistic herbs, because I could tell you, do podarco, do caprylic acid, you know, it would take me hours to again tell you how much and what size of animal and blah blah blah. And by the way, this is not for cats. Cats cannot take Podarco. This is for dogs. And but the Yeasty Beast protocol has all of those specific things in, so you don't have to run around. And again, there's Podarco and there's Podarco. Is it Podarco that's ethically sourced? It's Podarco that we, you know, you've seen a certificate of analysis and you know it's the cleanest one on the market, that kind of things. Because you don't want to add herbs to your dog's body that you don't know are really clean herbs or nutraceuticals and alike. The next thing that is interesting that you can do is you when you're dealing with skin disease and especially yeast, try really hard to only use cotton, hemp, or natural fibers for your dog to lie on or your cat to lie on. So if they're lying, if your couch is synthetic, put um, uh, a natural cotton sheet or blanket on your couch first, or hemp, things like that. It's a scientifically researched, proven, that that synthetics breed pathogens, and um, cotton and hemp actually don't support the growth of bacteria nearly like synthetics do. And I think it's probably because of the anaerobic part of it that they breathe, whereas synthetics don't breathe. So you'll get bacteria and yeast growing that grow exponentially better when they're in a situation where there's not a lot of air. Cross species bacteria cloth. Everybody's probably wondering, oh, where do I buy that? You don't buy it anywhere. You get as stinky as possible just before you go into the shower. You get a towel and you rub all your parts as much as you can. And you take that cloth and you lie it on your dog or your cat's bed. And what that's going to do is it's going to create diverse bacteria. We all live together. We are swapping bacteria all the time. And by allowing the skin to get as much diverse bacteria, bacteria is not bad. You want a diverse bacteria so that it overpopulates the pathogens. So I'm always saying that to any kind of skin disease, not just yeast. If you have an animal with skin disease, try to cross with anyone that lives in your household. Try and do this at least a couple of times a week, is changing up your towels. And you know, maybe 1 week you do it, the next week your daughter does it or whatever, and you switch it up as much as you can. The next thing, especially with yeast, is it stinks. It's stinky. It's kind of gross. And I can't tell you how sad it is when I used to see patients and people would be like, I just feel so bad because, you know, he can't come in the living room with us anymore because everybody thinks he stinks too much, or he can't get on the bed anymore because we can't stand how he smells, and can't get on the couch with us anymore because he's too stinky, or we have to put him in another room when we have company. I know it's brutal, but adding that stress and that feeling to your animal that it's unwanted, or that it's not perfect in your eyes, I don't know, it hurts my heart to even think about it, and I get it. But try to do other things, like let it come up when it's lying there. Take a really, really, really light cotton sheet and put it over. It's just like lay it over him. It's amazing just having that barrier that it'll decrease the smell a little bit, you know. Try and be mindful of their feelings around that. Try to be careful when your kids is like, oh, he stinks, you know, things like that. They get it, they feel it. And I know it's a hard call, but just really try hard to be mindful of that if you can. And what else? Oh, cones. I just can't stand cones. And you can buy different kinds of cones. If your dog has to wear a cone, please try and get them the one that sticks straight out and not the big, gross plastic ones that they're stuck in this funnel and they're bumping into things and stuff. There's lots of soft cones or soft collars that they can wear where they can turn their heads and look around, and it's a lot more comfortable. And when you're there to supervise them, please take it off. Don't just be lazy and be like, oh, I don't feel like watching them right now. Try to find some solution to get that thing off their head, because when they're stressed, their cortisol level is going to get really high, and that's going to contribute to a lot more. Stress induced is when we often see animals getting skin disease that have been just rehomed. Someone goes back to work, there's a divorce, the animal's best friend moves or dies, being alone too much, boredom, the list goes on and on and on. To help support that, we want to look at, finding sitters, daycares, a friend that has another dog that they can, you guys can, like, one day it goes to one person's house, the next day it comes back. Look for a new friend, maybe a second dog. Feed raw meaty bones so that they can get their endorphins flowing. Spend more time with your animal, more walks, loads and loads and loads more love, because there are definitely cases of skin disease that get triggered by stress. Stress-induced skin disease can be really helped with homeopathy, really helped. And with adrenal support, amino acids, adaptogens like medicinal mushrooms, lots of things to chew. And again, support the gut, because stress can actually also play havoc on the gut. And there are a ton of dogs that have come from pounds and foster dogs and dogs that have been given up that start getting, that I've been able to look right back, and their skin disease happens when they're given up, or when they are under a lot of stress. So the remedies that we used mostly at our clinic was Natmure. Natmure would be for an animal that you can visually see is sad. They want to be alone. They don't really want to be around company. They're having a hard time adjusting to being around the family. Natmure 200C, twice a day for 3 days. Give that, watch and see if the itching gets less or the skin disease gets better. And you can repeat that, right? So you can do it for 3 days. If it helps for a little bit and then it either stops or it starts to slide back, you can repeat it. And you can keep doing that as long as it's continuing to get better. Agnasia would be for an animal that are sad, but they want company and consolation, or they're a little bit hysterical, or they're really barky, or they're really, really chewing, or they're destructive. Agnasia would be for those type of animals. And again, do it twice a day for 3 days. And if it helps, then we watch and wait for a little bit. If it continues getting better, you don't have to repeat it. If it starts to slide back, then you can start it again. Or if it plateaus, you can give it again. Aconite 1M for fear, twice a day for 3 days. And that's for an animal that we definitely know the skin symptoms have come since there's been a huge fear. Stress-induced skin disease, or animals that have just come from, I don't know if you guys know anything about adoptions and parents and people, but with adoptions, they get you to put little stuffies and put little things under your underarms and to produce your pheromones to give to the child. It's no different. So if you're trying to introduce a new cat or dog to your crew, whether they're more animals or whether they're you, it's really nice to, it's going to help with the bacteria, but it's also going to help for that animal to be around your pheromones. And I know it sounds funny, but when you're doing it, when you're taking this cloth and you're rubbing yourself to get bacteria, just think really nice thoughts and allow that those hormones of your own that are endorphins and all kinds of hormones that produce that love feeling, really will translate onto those towels, and then put them around as well. So I really wanted to do diarrhea and vomiting. It's already 8:44, and this would have been another probably 8 to 10 slides. So what I decided to do is I'm going to write a really in-depth article, and with specific remedies to how to work with your animals, cats and dogs, along with diagnostics and what to ask your vet. And Stephanie's going to send that out to all the people that signed up for this seminar, and we'll get that out to you pretty soon. So stay tuned for that. We're not going to ignore that piece. We're definitely going to do it, but it's going to be way too long to try to do it in a webinar. And then next week in part 3, we're going to get into some of the sad stuff and some of the intense stuff and some of the really, really scary stuff like cancer, thyroid disease, Cushing's, kidney disease, chronic diseases, biopsies and tumors, diagnostics, and euthanasia, and more. But we're not getting into this to scare you. We're getting into these to empower you. We're getting into these to help you reduce your stress and your fear around it, and know that you can work with this stuff, and you can be your animal's primary support in their healthcare system with all of those diseases. You don't have to feel like you aren't prepared or that you aren't equipped. We're definitely going to help you get equipped for all of these things, understanding the diagnostics and understanding biopsies and tumors and what to ask for. And that's it. Thank you very much. Those are some of my animals and some of my rescues and some of my patients. So Steph, I guess do you want to stop the share, or do I have to stop the share?
I can do it.
Okay, awesome. Thank you. Can you do it?
Yes, sorry.
It's okay.
All right, can we do a couple questions maybe for 10 minutes?
I still feel like why is this like this? Okay, yeah, go ahead.
All right, so much gratitude for the information. Thank you for everything tonight, Julie.
It was fast, sorry guys.
Gosh, it went by quick, but actually we've all been hanging out for like 2 hours.
I know. And at any minute, my dog's probably going to lose it because someone's going to be coming in to do a night check and a tuck in with all the rescue horses. So,
oh, well, that'll be our cue to call it. Going back to the spay and neuter, can you talk about the possibility of the balancing of the risk of developing pyometra? So her dog's not spayed. She is very careful she won't get pregnant, but is pyometra really as high risk as they say? Does ovary sparing spay still risk pyometra?
Someone just said they missed part of it, so it's all going to be recorded, and they're going to be able to see the whole recording. I just saw in the chat that they missed some of it. Pyometra is a very close to my heart, because my love, one of the love of my life, Stella, she was a unspayed female and got pyometra when she was 9 years old. And I think the reason that she did was because I got Henry. He's been walking around in here. And I didn't neuter Henry. So I think the combination of her not being spayed and so desperately, she was such a mama. She raised my kittens and everything. Her desire to be a mother, and then being around an intact male, it just happened. And the risk is fairly high. I think you just need to be super aware of it. And I wrote a pyometra. Don't I have a pyometra article?
Yeah, you do. It's actually Della's story.
Yeah, it is Della's story. So Stephanie can maybe find that and share that with you. I would read that, and because I go over the percentages and the risks versus the benefits. And I go over things like first signs and trying to prevent it. And there's a lot, with pyometra. And, the bigger the dog, the more the risk I have found in my practice. But it's scary if you don't catch it. If you don't catch it, it can be pretty detrimental to them. So if you're a very conscientious helicopter mom, like I call myself, then you can catch, I'm pretty sure you're going to be able to catch it. And in that article, it talks all about the signs and symptoms of how you would know if they are getting pyometra and what to do.
Perfect, Julie, thanks. Here's another one that piggybacks on that. Allison's asking, can or should I add homeopathic remedies for post-spay and neuter even years after the surgery? Let's say we just got into homeopathy, or we're just listening to your presentation here tonight. Could it still be beneficial even 3 to 9 years later?
The hormone one, 100%. Yeah, absolutely. The one that I was saying that Andrea Ring sells, it's beneficial at any age at all.
Perfect. Okay, Margaret, older dog, hip dysplasia, specialist not recommending hip replacement or FHO. We're doing physio, swimming, cold laser, as well as platelet-rich plasma and shockwave therapy. Would you recommend something similar for the cruciate? So this question might have come in before you hit the cruciate slides.
Yeah, it must have, because I went over all those, right?
It's a lot of the same things, yeah, that you mentioned to be beneficial.
Yeah.
Julie, what about raw meaty bones? Could you talk about
what I was going to say too, though, with hip dysplasia, often we're focused on joint, and yes, it's definitely joint related. But hip dysplasia, you can get a lot of nerve pain and a lot of muscle cramps and muscle spasms. So for hip dysplasia, I would really want to support the whole muscular skeletal system. So, with dimethylglycine and all the remedies that I recommended for the cruciate one for jump for joints. So symphytum and ruta and arnica. You want to try and look at any kind of joint problem as a scaffolding and support. I do this with everything. I look at symptoms. So in our liver tonic, let's say, I don't support the liver. I support the liver, the kidneys, the pancreas, and the gallbladder, because those are all game players. Those are all the supported team of the liver. So if the liver starts to not function at its optimum, those other organs jump in to take over and support. So when you're supporting anything, including joints, you shouldn't just be doing a joint formula, in my opinion. You should be looking at muscle metabolites, you should be looking at magnesiums, and you should be looking at the periosteum of the bone. A lot of companies don't even think, or vets don't even think of the periosteum as the lining of the bone, and it is what gives the bone its nutrients and its blood flow. And it is often damaged with arthritis. It's often damaged with age. It's damaged a lot. So making sure that we're supporting every possible structure that supports the joint, not just the joint itself, is ultimate for keeping that system healthy and not a pain.
Thanks, Julie.
Okay.
There's one here.
You're just asking me something and I interrupted you, sorry.
Oh, that's okay. That was important. Oh, yeah, the raw meaty bones. Can you talk about a few that might be appropriate for a snub-nosed kitty? Do you feed your cats? RMBs?
I feed my cats chicken necks.
Right.
Yeah, yeah, big time. I hold them and I do that whole dental thing where they start chewing on one side and they're like, "Eh," and then I move them around to the other side. So yeah, it's cats love bones, and it's nothing stops a cat. You can give a cat a big hunkin' bone. They'll just chew on it. They won't be able to bite through the bone. But make sure though that there's not like big hunks of cartilage that they could rip off and then swallow and choke on. But a raw meaty bone that can for a cat that they can get into chewing off the meat, that's great. They probably won't be able to get bone for their anal glands and things like that, but that's where chicken necks and things come into play for that is digestible bone.
Thank you.
Welcome.
Ellen, okay, so you talked earlier about immune support and that it can potentially not be good if there's an autoimmune thing going on. Can you talk more about that, Julie? We
Yep.
give immune support for allergies. Should we be wary of the immune support?
Yeah, you should be. So that's why I said immune support was for kennel cough, right? Bordetella. Anything viral or an overabundance of bacteria, you want to make sure that the immune system is strong. But anything like allergy, skin disease, Cushing's, cancer, things like that, you want to be careful that you're not ramping up the immune system, because autoimmune is when the immune system's already too high. So you don't want to make it higher. You want to modulate it. Modulating the immune system, we're going to get into that next week too with diagnostics and cancer and things. Modulating the immune system is key to any chronic disease and key to any kind of thing like hyper and hypothyroidism, or like I mentioned, cancer, Cushing's, allergies, things like that. So immune modulators are things like larch. Our prebiotic larch is a great immune modulator. Medicinal mushrooms are a good immune modulator. So when the immune system goes too high, it modulates it, and it sees it and it brings it down. If it goes too low, and it can get into secondary bacterial infections or an overabundance of bacteria or viruses, it starts to bring it up. So a modulation is huge. It was one of the things when we did the research on the canine species specific probiotic, that particular bacteria was incredible for modulating the immune system. So there's lots of things out there. When you give a steroid, which is what they give for autoimmune diseases, the reason they're giving a steroid is steroids are immune suppressive drugs. So it suppresses the immune system, it pushes it down. But then what happens is you have all the side effects of suppression, right? So, liver disease, kidney disease comes along with steroid, giving steroids, the breakdown of cartilage. And then the biggest thing is once the body gets used to that being that suppressive dose, or you have to wind up taking them off, the body rebounds. And then that autoimmune disease becomes exponentially worse than even when you started. So immune modulation is a big deal, a really, really big deal.
This is familiar. It reminds me of last week. I believe you gave your leaky pipe with the duct tape analogy.
Yeah.
Which is super helpful for me.
Yeah, well, skin disease is a big part of that, right? So when I was talking about when you have skin disease and let's say the puppy or the kitten just starts off with a bladder infection, or it starts off with something else that has been suppressed. Believe it or not, when your animal has skin disease, it's screaming that it's still healthy enough to get rid of an underlying disease. I know that sounds ridiculous, but it's the organ that is the least life-threatening is affected. It's not the liver, it's not the heart, it's not the kidneys, it's not something that is vital as vital. So when you look at the layers of the body and you think skin disease, that's what kills me about it. It's the least life-threatening, but it's the highest elected euthanasia of all diseases. So, and it's because it's so misunderstood. And the majority of treatment for skin disease is to suppress it more, just to keep pushing it down rather than going deep down, figuring it out. What is the underlying disease, treating the underlying disease, therefore the skin disease gets better, right? It's like taking layers off.
I would say personally, it's also very difficult, and you need patience to deal
Skin
with it.
disease is one of the hardest diseases to treat. But I think that's because we're treating it to try to get rid of it and rather than looking at the vitality of the animal or the person and getting down to the nitty gritty. Is it being caused by stress? Is it being caused because they don't have enough sex hormones? Is it being caught? You may never find out what the real causation is, but you got to try and work towards that goal, right? So, I've treated thousands of skin diseases and animals with skin disease. And I think that the emotional, hormonal element is really ignored. It's not looked at enough with skin disease. And if you can pair together emotional, hormonal, and gut health, like the bacteria, you're going to exponentially be able to deal with your animal skin disease. Next week, we forgot to put a picture on. I really wanted to put a picture on. But next week, maybe we can start off for all the people that watch this, we're going to put a picture on of the dog that I worked with that really kicked my butt into doing a deep dive on how to navigate skin disease.
Is that little angel?
Yeah.
Okay. Yeah, I'll be sure to include that next week. Everyone, it is 8:00 my time, 9:00 at Julie's house. We're gonna finish this lecture off, and please join us next week. I'll send the link tomorrow along with the recording to this session, and you can register for next week, the final of Julie's 3-series lecture, Are You Vet Ready? Thank you so much for joining us.
And are we giving a discount code or something? I thought we were giving a discount code. Can't we use the one not for last week?
Maybe I'll sneak a little something into the email tomorrow.
Okay.
I can sneak a little something tomorrow.
I was going to say for everybody like hanging in there till 9:00.
Hey, everyone hung out all night.
I know.
Really cool.
I know.
Okay, we'll see you all next week. I'll email you tomorrow with the recording, perhaps a little something, and the registration link for next week.
Okay, awesome.
Okay, good night, everyone.
Thank you.
Bye.
Bye, everybody. Thanks.